Muscles of anterior abdominal wall. External oblique. Origin. By 8 fleshy slips from the outer surfaces of lower 8 ribs. Insertion. By fleshy fibers into the anterior two-thirds of the outer lip of iliac crest. By aponeurosis into xiphoid process, linea alba, pubic symphysis, pubic crest and the pectineal line. Nerve supply. Lower 6 thoracic spinal nerves. Internal oblique. Origin. Fleshly origin from lateral two-thirds of the inguinal ligament. Anterior two-thirds of the intermediate area of iliac crest. Thoracolumbar fascia. Insertion. By fleshy fibers into the inferior border of lower third or fourth ribs and their cartilages. By aponeurosis into 7th, 8th and 9th costal cartilages, xiphoid process, linea alba, pubic crest and the pectineal line of pubis. Nerve supply. Lower 6 thoracic and first lumbar spinal nerves. Transverse abdominis. Origin. Fleshy origin from lateral 1/3 of the inguinal ligament. Anterior 2/3 of the inner lip of iliac crest. Thoracolumbar fascia. Inner surfaces of the lower 6 costal cartilages. Insertion. By aponeurosis into xiphoid process, linea alba, pubic crest and pectineal line. Nerve supply. Lower 6 thoracic and first lumbar spinal nerves. Rectus abdominis. By 2 tendinous heads. Lateral head from lateral part of the pubic crest. Medial head from the medial surface of the pubic symphysis. Fifth insertion. 5th, 6th and 7th costal cartilages. Xiphoid process. Nerve supply. Lower 6 or 7 thoracic nerves. Actions of the main muscles of the anterior abdominal wall. Support for abdominal viscera. The abdominal muscles provide a firm but elastic support for the abdominal viscera against gravity. Expulsive acts. The oblique muscles, assisted by the transverses, can compress the abdominal viscera and thus help in all expulsive acts like micturition, defecation, parturition, vomiting, etc. Forceful expiratory acts. The external oblique can markedly depress and compress the lower part of the thorax, producing forceful expiration as in coughing, sneezing, blowing, shouting, etc. Movements of the trunk. Flexion of trunk or lumbar spine is brought about mainly by the rectus abdominis. Lateral flexion of the trunk is done by one-sided contraction of the oblique muscles. Rotation of the trunk is produced by a combined action of external oblique with the opposite internal oblique.